Good morning. Good morning and welcome to Obasaki Solicitors. Today, we're going to be talking all about the healthcare worker visa and sponsorship and the things that you need to know if you're going to be coming into the UK as a healthcare worker. This session was postponed due to busy schedules and also ill health. But now we are going to proceed with the session. So once again, this is Obasaki Solicitors. We're going to be talking to you all about the healthcare worker visa and things that you need to know with regards to coming into the UK as a skilled worker, as a healthcare professional, and also with regards to points-based systems and what you need to know about your sponsor and also your terms of employment. So first of all, we need to think about what is a skilled worker. So a skilled worker coming into the UK is somebody who has a job that is enlisted on the shortage occupation list. And you can get a copy of this shortage occupation list online if you just type into Google UK shortage occupation list. What will come up is a list of fields of employment and job roles which the UK economy is looking to fill. And these are compiled based on the economic requirements for the UK. We have situations at times where the UK needs to fill gaps, and the list is adjusted according to those gaps that are needed. And hence there's this new high demand for the healthcare worker visa. Now, it's not just isolated in one place, so it's across the UK. And professionals that come in have to really meet the specific demands by having the correct qualifications and also having the correct person to employ them. And the person who is going to employ them will have to have a sponsorship license unless there's other provisions within the immigration rules. The immigration rules, as you're probably aware, can be found within the immigration legislation. However, during periods like this, the legislation is amended to accommodate the economic need and the need for quick change. So right now you'll see some of the things some of the professions on the list are engineering, medical and health services, artists, dancers, scientists, and lab technicians. Now, within recent times, the salary requirement for skilled workers has actually dropped down. It was much higher previously. It's now 25,000 British pounds. And that equates the hourly rate in the UK. There's a minimum wage, which is £10.10. And that changes usually annually around April in line with the tax year. Now, the ones for the shortage list drops down to 20,500 per annum. And this is really important because the UK wanted to bolster certain areas, including the healthcare sector, because of the number of the shortage of workers. And why people might ask, why is that? Why has the number of workers reduced? A lot of people became fatigued, left the profession post-COVID, and really there's just a high demand on the healthcare industry here in the UK. Now, the reduced salary requirement to 20,000 may apply to applicants who are under the age of 26 years old. and who are a graduate or trainee manager. Applicants who hold PhD levels or qualified hire may also enjoy a reduced salary, and that's also to increase the number of people within those technical fields. And it also, you have to really see that the qualification is really going to be scrutinised. It's also a heavy burden on the sponsor to make sure that paperwork is in place. And we'll talk about that briefly later. So if you're a sponsor and you're thinking of recruiting people into this field, it can be quite paper and administrative heavy, a little bit bureaucratic, but there are systems in place that can help you. Now, the healthcare service jobs. Again, this is down to the minimum that has to be offered by way of salary is 20,480. We've been hearing about some unscrupulous agents who are trying to cream or take fees and put people into situations where this minimum is not being offered. So please be careful. You should be applying directly to somebody who has a sponsorship license. And if you are using an employment agency, you should still be earning this minimum amount of money. There should be nobody taking money on top. I've heard about deductions for accommodation and other things like that. Once again, you have to be very, very careful. Certain practices are actually regulated here, especially when it comes down to employment, even if it comes with the provision of accommodation. There are rules. So be careful you don't fall foul of fake agents and unfair employment arrangements. So medical practitioners, pharmacists, opticians, basically, dentists, dental nurses, psychotherapists, nurses and midwives, all of you can fall into this section. We've done another session that you can find on YouTube, which is purely to do with doctors and nurses. But now that they've expanded this whole job shortage to healthcare professionals and healthcare support workers, people who are not your formal dentists, formal nurses and doctors can equally fall into this category. And even if you're not formally qualified within healthcare, you can still study up to the level 3 and 4 diploma, even level 2, and start making your way onto this pathway. Now, professionals who are applying to come to work in the UK under the skilled workers visa must prove that they also have a good understanding of the English language. And that includes a test for listening and speaking. Applicants whose degrees are delivered in English can rely on their degree qualification, and usually it means the head of your faculty or your university writing a confirmation that your degree was taught in the English language. However, if certificates are issued by institutions outside the UK, they must have that NARIC verification on it as well. That's another way to make sure that you can prove that you speak sufficient English. The other way is to do a B1 level, and I know many people, sometimes it takes their universities to write a long time to write the validation of their qualification, so they just go and do the test quickly. But in order to save money, if that's something you can do, then do it. But if you can't get the validation on your degree qualification, you may need to do the B1 qualification. Once again, you can go online and find out different places where you can do the B1 or the SELT English test. There are some other countries that even though English is used commonly in their country, it's not just accepted as a matter of fact that you speak good enough English. You still have to prove with an exam. And then there's a list of countries where there is an exemption. They don't need to prove anything. It's taken for a fact. So be careful, check, and if you're not sure, reach out to us. We'll be able to clarify that for you. So if you're in a country that has an exemption, you don't need to prove the English fine, but if you're from a country that you have to do the English test, then you do need to get on and do it. Now the fees for processing the application are quite standard. So if you're the main applicant, then it's 1,270. Sorry, if you're the main applicant, then it's 1,560. And what you'll be granted is 2.5 years. You also need to, sorry, that's a mistake. So there is a fee payable, and the fees payable for the application is quite high, but you also then have to budget for the additional NHS surcharge, which is again quite a large figure. Please also be wary of agents who are equally trying to charge people additional sums for this. The fees are very clear. You can get them from the Home Office website. And when you are making this application, you also have to show that you have a level of funds in your bank account. It's also important that you know that if you have any dependents who are coming with you, they also need to pay for their application. And also children have to pay as well for their applications, and the fees are there. Once again, if you have any questions around this, you must also contact us so that you make the right payments. Now, can you bring your family? That's the #1 question that we always ask. Can I bring my partner? Can I bring my child? And the answer is yes. The visa is granted to the applicant and their dependents, and it's important that you can make this at the same time. And what is a family member? What is a dependent? A family member is obviously a biological family member within your immediate nuclear family. We also see the definition of extended family members, but those are normally considered your dependents. So anybody who's under 18 and financially reliant on you is somebody who you can bring in as your dependent. They must be husband, wife, civil partner, unmarried partner. So if you've been together and you've not been married for one reason or another, they can still be considered. And the child of the applicant must be under the age of 18. We have seen some circumstances where children over the age of 18 are in full-time education but under the age of 23 are reviewed and looked at. But you may have to have special circumstances, such as if the child has a level of special educational needs, then there's still a level of flexibility, but it is rare. With the points-based applications like this, the Home Office and the UK visas usually stick quite strictly to the rules. Are you able to apply to extend after the 2.5 years? The good thing is, yes, you are. You can be able to apply for indefinite leave to remain. So far as you show that you've not breached rules, and you continue to apply for extensions in good time. However, with the healthcare workers visas, you are supposed to go back. The new provision at the Home Office has put in place. So with other categories, it can be possible after 10 years lawful residence. Yes, it can. So if you're in one category already in the UK, can you switch over to the skilled workers visa? The answer is yes, you can. So is it possible to switch? Yes, you can. Those already in the UK that are here on a different criteria can switch to the skilled workers visa. And that's if you come in as a student and you might want to stay and do your post-study and do that switching. That is also possible. Those in the UK on a visit, however, you cannot switch. You have to then return to your home country and apply correctly under the right category to come back in. So you have to be very, very careful about that. So there are requirements for applying for the skilled worker visa from outside the UK, and they're not necessarily the same as those who are applying to switch inside the UK. So you have to be quite careful. Well, it's important that you also look at some of the criteria for switching into just a general skilled workers category. You have to do 20 hours of, you can do extra 20 hours of work outside the main sponsors job. This means that even if you have one main employer, you can still take up additional work outside that contract of employment, which is quite good. So a lot of students who switch into this category find one employer, but then get themselves a supplementary job. So that is quite important. And you must then get a certificate of sponsorship though, if it's going to take on more than the 20 hours. So if it's going to be a contract that's more than 20 hours, you have to then think about taking on, making sure that person has a second sponsorship license. So as a recap, you have to make sure that you do come into the UK under the right route when they apply for you to stay as a skilled worker. One, if you're in the UK, you can switch. The other way is to make sure that you come in under the point list and are able to engage with somebody, an employer who has a sponsorship license. But when we want to focus now on the healthcare worker visas and sponsorship licenses for those who are thinking of taking on individuals within the healthcare industry, there is some official government slides and training that you can look at. I just wanted to share my screen and show you some of those. So if you are looking for more information on the healthcare visa and the skilled workers visas, you can get some official Home Office information, which this is some of that. And as you will see, they're very clear. The points-based system, you must have the job offer, skill level, and English requirement, as we explained to you earlier. You must meet this score, 70 points, which is really, really clear. And 50 of these must come from meeting the mandatory criteria. So that means it's non-compromisable whatsoever. You must achieve 50 points from this. So this is the job offer, skill and English. Then the rest of the points that you make up the 20 can come from either the salary or other relevant points such as the nature of your qualification. So really, really important. So from salary through to your field of work and study is really important. Again, when people are offering you these things, if they're agents and they don't have a sponsorship license, then you could be being misled. So be really, really careful. So your common area are your doctors, nurses, and healthcare workers, especially the healthcare workers, since it's been launched in February 2022. And what's really, really important is that you are being offered work from a person who has an approved sponsorship license. If not, then the people that you're talking to, once again, may be considering themselves as agents, but if they cannot guarantee you the employment, then you're really just not putting your money into a certain proposal, let me say it like that. And there should be no need, because the sponsors that are out there are really looking to recruit, to fill gaps in their workforce. But some, again, maybe not ready to offer you proper contracts, so you have to be really careful. You must make sure that they are offering you a valid contract of employment that meets all the requirements here in the UK. So you must meet the English requirement. You must be being paid a minimum amount of £20,000, 480, and that equates to £10, 10 pence per week and 39-hour week. And the workers, again, if you're a care worker, again, you must be a level 3 to be able to come in under this points-based system. And, you know, when it comes down to the level of your qualification, if you're just a healthcare worker, you're into the field, you can top up these qualifications online. Think about it. We're in a global society, so try and do your studies in a formal institution, but if you can't, look for recognized overseas education providers who can help you top up so you meet the level 3. Okay. Okay, so the healthcare worker visa, this allows people to come from the medical profession and to stay here and do a job eligible with it in the NHS, which is the National Health Service, or an NHS supplier or adult social care. So again, look at the criteria, don't be misled by agents, and you must be either a qualified doctor, nurse, or healthcare professional, adult social care professional, eligible to work in the system. Now, the employer must, as I've been repeating throughout this, must be approved by the Home Office. If they're not, you're being misled. Okay, and how you know is they have a certificate of sponsorship. Again, agents may promise you, oh, we've got employers, they have a certificate of sponsorship. Obviously, you hear what people have to say, but the proof is in the pudding, and you know, it's about show and tell. If they do have a certificate, then they should be able to show it to you. Okay, you must be paid the minimum salaries we discussed before and have the English requirement, which we discussed also. Your visa can last up to 5 years before you need to apply to extend it, and you can apply to extend it, as we've said, so far as you apply in time. Do not overstay. Make sure you make the application in time. Okay, so these are some examples that are set showing how individuals who are making the application have their points calculated. So the example of Aisha is there for you. And it shows also which points, as we've said, are compulsory, mandatory, non-negotiable, and then the ones that you can trade with regards to the field of study and also the field of study that you've had, or the nature of the job. Okay, so when you look at the labour pool in the UK, it basically is a mixed bag. You have people that come in temporarily, people who live here, you have British nationals, you have different people, but everybody then who have who are eligible to work either fall into one or another category. So either you come into the UK and you're a student and then you want to do the skilled worker route, so then you apply once your studies are finished to stay, or you come in from your own home country, get employment by a sponsored employer, someone who has the Home Office sponsorship license, or you're just an ordinary national who lives here and you just gain employment by direct application to an employer. But there's so many different mixed people in our cosmopolitan community here in the UK that make up the labour pool, and even family members, obviously, of people who are here can then be eligible to work, family members of students as well. We've also had the situation where the UK has left the EU. So many people went back to their home countries and didn't stay in the UK. And again, people who were here from the EU, many of them have invited their dependent relatives. Everybody makes up the pool, but some work for employers who have sponsorship licenses, and some work for people who are just not interested in having a sponsorship license and just recruit directly from the labour market. And that means those who are here, who are native to the UK, born in the UK, and just want to take up employment. So as an employer, if you are here in the UK and you are thinking, gosh, I could expand my workforce by getting one of these sponsorship licenses, how do I do it? And you might work in the entertainment industry, you might work within the medical field providing healthcare, you might even run a laboratory. Now with the COVID testing, thinking I'm going to expand this, how do I do that? I need more skilled workers. Then this is the, this next segment is for you. So you need to apply for a sponsorship license, and it can be, let me say, in the past it was a bit more bureaucratic, but now the government has realised that it really needed to make the process a bit more seamless, simply because of the demands in industry, even within things like the food industry. Restaurateurs were saying, look, you had this category of the employer or us as employers not having a takeaway service, whereas now more than 50% of our business is through orders online. So the government then had to rethink the way that the economy has changed and how to make sure that businesses are able to look into getting their sponsorship licenses should they so desire. And then the ultimate was really the healthcare crisis, where there was a shortage and the government realised that it needed to bring in or enable workers come into the UK much more easily. And even the fuel crisis with the lorry drivers, again, was a temporary measure put in place to ensure that there was sufficient workers in the UK to meet the demand of the economy. So as an employer, if you're a business person here, then you need to think about why you want to recruit people. Is in your business plan, and really making sure that if you're going to employ from outside the resident labour market, that you can qualify for the process. Now, you can tap into this, obviously. There is no monthly fee. There is a straightforward application that you make the cost over £500. And you must also be able to show that you cannot really fill that gap from people within the UK, and show that you've tried to do that. And this is called the resident labour market test. So it's really important that you try to show that you've done that by looking at the application, the adverts that you've been putting out. And now, because of the changes, employers do not need to be a sponsor to employ someone from the resident labour market with an existing right to work in the UK. It's enabled you to really look all around the world and go outside. And workers that come in are now able to switch from one immigration route to the other without having to leave the UK. Previously, if your sponsor changed, or if your sponsor maybe as an employer, if you had problems and then you could no longer continue employing people, those people's visas would be at risk and would have to leave. But now there's been a bit of a relaxation, so people can switch in country to a new employer who has a sponsorship license if things go wrong. And that used to be really touchy for people in the tech industry back in the day, and as well as nurses and doctors who had issues with the NHS trust. It used to be quite difficult, but now there's been a relaxation. So in 2022, there's been the idea, as I said, the government has realised they need to do things faster, making it easier for them. They're reviewing their standards, as you can see, and addressing the barriers to getting the license, especially to the smaller businesses. And that's really good news, because it really is not big companies' problems. The NHS, etc., used to be able to have a better dialogue with the Home Office, and whereas the smaller care home owners would find it quite difficult. But as you can see, they're saying they're looking into that. The fact that they're trying to streamline things is excellent. There is you have to, as an employer, also identify a designated person, and that person is somebody who signs into what will be your Home Office portal to update and receive information and be the key person for information. But the way that the government is now saying that they're trying to make sure that there's better correspondence their own end, so that there's less likelihood of abuse, and allows you as the sponsor to have updates much more easily. That's all very good. So there's all these changes to the existing systems hopefully will bring back better management and obviously better engagement strategies. So it means that the government has also started looking at having stakeholders, advisory groups. And obviously, if you are really, really keen, you can try and see if you can become part of those attempts to improve things, which is really important. It can be very hard for employers to go about verifying your employees' right to work. And apart from somebody coming up to you saying, this is my passport, have a look, and these are, you know, the relevant visas, etc. Within the UK, there is an online portal where employers can actually go and verify individuals' details. So you can imagine if you've recruited people from abroad, you've checked them all out, everything's fine, and then suddenly one or two want to go, then you've got a gap, and somebody comes and applies to you saying, look, I don't want to work here anymore, can I work with you, you've got a license. How do you check that person to make sure that they are qualified to work? So again, there are portals that you can log on to that the government holds as a database that easily verifies people's IDs, and from July, the process for that kind of change, especially with all the EU registrations that were going on. So certain identification documents are no longer accepted. So it's really important that you follow the correct process. And if you have any doubts about that, you can go online and check within the government, the .gov website, and it will take you to the right place. But basically, you should look for photographic ID, making sure it has them and it confirms that they have the right to work in the UK and there are no conditions. And you must make sure that you keep copies, and when I say copies, a good record of how you have validated the person's right to work checks. And the failure to do so in the UK can come with sanctions and fines. So it's really, really important that you go to the .gov website and do the check correctly. And also that you keep your processes documented. That's like really, really important. So there's lots of different guidance that's out there as well. Make sure that you go on to the .gov website or the Home Office website, and you can see that there is UK points-based system, introductory manuals, there's all kinds of resources and guidance for employers. And so even if you're not an immigration specialist, or you want to become the designated person for your business, and if you are in control of the decision making, you should really take note of this. It's not just straightforward human resources, it's actually quite specialized. And if you do have somebody who's in charge of your human resources, you should let them do some training on this so that they're fully aware of what they should do. It can be difficult, especially when you are being held to account. For example, the Home Office can come out and inspect you and have an inspection of your systems. So it's important to follow the toolkits, get the correct resources, even if it's software in place, and really streamline your own in-house processes with regards to applying for the license, maintaining your employees' data, verifications or checks on how you onboard people, making sure that they're fully qualified. Otherwise, you could find yourself in problems. So first of all, with regards to the license, and you've decided, yeah, we're going to apply for this sponsorship license, how do we go about it? Is it in the business plan? You've budgeted, you've forecast for it, it's all cool. So what you do then is you check whether your business is eligible. There's different fields within industry as to who can and who cannot apply for the license. So apart from that, you think about what type of license am I going to apply, how many people, and then once you've made that decision, basically you have to realize that you then open yourself up. The government may decide that they're going to come and inspect your premises. Apart from paying the fee, you must pay the fee, and then the government may decide, actually, we're going to go and check on them. And you can have a visit pre-decision, and after having decision, you may have spot check visits. So it's a continued process, and one of the reasons why you must ensure you are maintaining the procedures and have the right designated person in charge of dealing with this, the responsible person in dealing with this. And after you apply, you'll be given a license rating if your application is successful. You'll be able to use that certificate of sponsorship for the jobs that are deemed suitable within your industry, and then it will be valid for up to 4 years. But you may have monitoring visits during that period, so be sure. Okay. Now, the issue with regards to why some people don't get it right, if I say it like that. Often people are in a hurry, maybe they've not taken advice, maybe they've underestimated the requirements with regards to the maintaining of documents. Possibly they've decided to try and take shortcuts, various different things, but just simply don't become a victim of that situation. Ways to combat making mistakes: give it time. As you can see, the process for getting the sponsorship license can take up to 8 weeks. Plan, because what if you don't get it in your first round? You may have overlooked certain resources that you need. Study the toolkit in itself. It has a lot of resources in there. And then be very true and honest with yourselves as to what you really need, as opposed to just having it out there and overstretching yourself. There is a minimum financial requirement with regards to salaries, making sure that you are, again, vetting people that are coming in to make sure they are the right fit for the role. That's also a really, really important thing. And making sure that you again have reviews of your own processes. If you're not checking that things are going well or going correctly, then it can, again, prospectively lead to problems occurring that you might have picked up on earlier if you were reviewing things. So really, really important that you try to have your processes in place such to the point that you are also reviewing them. Okay, and so that is really the end of the session. With regards to how you can take things forward, if you are an applicant who's thinking to come in as a skilled worker, either a professional doctor, nurse, then I would say have a look at the other video that we have on YouTube, which details the qualifications that you need to obtain, support that you also might need when you're here, and how you can get that support. If you're coming in as a healthcare support worker, then again, look at your qualification. Do you meet the criteria? Do you also meet the English qualification? If you do, have you got contact with a sponsor who has the capacity to take you on, both financially and meets the requirements, has the sponsorship visa, has a sponsorship license. And then once again, if you are a sponsor and you are wanting to bring in people from abroad due to the fact that the resident labour market doesn't meet your demand, or the way that your business works, you need to have specialists to fill your gap from outside of the UK, then once again, look at the requirements. It's not as bad as it used to be. The government's trying to open up the process, and you can try to get a decision within 8 weeks if you're ready. Don't rush at it. Make sure that you've got your business plan, your toolkits, and all the requirements in place. And you can equally contact us here at Obasity Solicitors. We'll be more than happy to help you. That's if you're an applicant or if you're needing help with your sponsorship license. Again, it is not just about healthcare sector. You can be a sports agent, entertainment, within the entertainment industry, and have the need to fill a particular gap. So really think about how your business could expand if you had the sponsorship license, and whether you have the capacity to add it to your business portfolio so that it increases your staffing in the UK and your operations. And our email address is info@obacitysolicitors.com. Our phone number is +44 207 739 7549. There is also a WhatsApp number you can get to, which is +44 7956 414488. Once again, my name is Jennifer Obasity, and here at Obasity Solicitors, we'll be happy to help you with all your legal requirements. We're specialists in immigration law, but also deal with commercial-based and social welfare areas, and multi-award winning with offices in Hong Kong, Nigeria, here in the UK, and consultants from all different parts of the world. So not a question that we would not be happy to help you answer. Stay blessed, stay safe.